So with that, I'm honored to introduce Dr. Evan Nelson. Dr. Nelson is a neurologist here. He's our chief resident. He's an expert and is building a career in neurodegenerative diseases and what is the underlying biology that impacts our memory. This is a game of proteins that he'll regale us with things like amyloid and tau and alpha-synuclein and TDP-43 and all sorts of other alphabet soup. So with that, welcome, Dr. Nelson.
Good morning. Can you all hear me well? Good. All right, I've conquered technology, at least for now. Perfect. Thank you for the kind introduction, Dr. Hoden, and thanks to Dr. Rainey as well for inviting me to give this talk.
If you want to wander, you can use that.
Okay. I will wander, but not out of the room. So it's my honor to give this talk to everyone. And this talk concerns the pathologic basis or the underlying disease process for diseases such as Alzheimer's, Parkinson's, Lewy body disease, and so on. And one of the things that has been really striking to me as I've gone through residency has been how difficult this topic is to translate from physician to patient, and how confusing it can be for patients. And in the clinic, especially in the last 2 years for me, this is something I've really focused on, trying to help people understand, because if they don't understand this topic, their understanding of the rest of the disease is confounded. So hopefully, I'll be able to translate some of the understanding that we have to all of you, so you have a better understanding of these diseases. And I'd like to start with a diagram from one of our educational journals, and that shows how we look at these diseases, but can be really confusing for patients. So for Alzheimer's disease, we look at, for underlying pathology, we look at two molecules or two proteins called amyloid and tau. And then for Lewy body disease, and also for Parkinson's, one called alpha-synuclein, and then frontotemporal dementia, and at least one other disorder that we'll touch on briefly. We look at molecules called TDP-43 and tau. So, but all of these have a commonality. They're all proteins. And proteins are very important for brain function, and they help brain cells signal to each other. They help brain cells repair themselves, adapt to changing conditions. But when these proteins malfunction, whether it's through them assuming the wrong shape or through them accumulating into things that we call aggregates, which we'll discuss later, or when you have more and more of those aggregates, they're not cleared well, and then they're toxic to cells, all of those things can cause disease. So I wanted to include some pictures of these as well, so you can visualize what's actually going on in the brain for each one of these diseases and each one of these proteins. So we'll be talking about Alzheimer's disease, like I mentioned, which will cause changes in memory and will cause cognitive impairment. And Alzheimer's is associated with two molecules called beta amyloid and tau. And you can see on the figures here, you can see something called an amyloid plaque, which we can see in the brain in Alzheimer's disease. And you can also next to it see a neurofibrillary tangle. Of course, the first you'll see with accumulation of beta amyloid. And the second one, the neurofibrillary tangle, you'll see with accumulation of tau. And then one of the other diseases, like I mentioned, that we'll talk about is frontotemporal dementia, where you'll see changes in personality. You can also see changes in movement, and you can see changes in language. And that can be associated with tau, and it can also be associated with TDP-43. And you can see, like as in Alzheimer's, you can see tau can accumulate as neurofibrillary tangles, and then you can also have TDP-43 inclusions, which are those aggregates of protein. that are toxic to brain cells. And then for Parkinson's and Lewy body disease, these are what we call alpha-synucleinopathies. And you will see collections of, you will see things called Lewy bodies, which are collections of misfolded alpha-synuclein. And those can cause, again, some problems with movement, especially sleep, issues with sleep, and also hallucinations. So I mentioned, all of these diseases have to do with a certain problem with a protein. But that begs the question, what is a protein? So the basic building block in our body is called a cell. And a cell has different parts. The center of it, so to speak, is the nucleus. And the cell nucleus houses DNA, our genetic material. DNA is made into a slightly different molecule called RNA. And RNA is brought from the nucleus further out into the cell, into a place called the cytoplasm. And that is made eventually into protein. And then after proteins are made, they are processed in many, many different ways so that they have the appropriate function. And a lot of the diseases we'll talk about, as I mentioned, have to do with problems with protein function, accumulation of too much protein, and so on. So the first disease that we'll talk about is Alzheimer's disease. And so the first two underlying pathologies we'll talk about are accumulation of amyloid and accumulation of tau. So what is amyloid? Amyloid protein is a very important protein in the brain, and it has a lot of positive functions. In fact, this protein is so important that we see it throughout plants, animals, bacteria, everywhere. We find it in many, many different living things. For us, it has many different benefits. It has antimicrobial effects, including antiviral. It also has anti-tumor effects. And it can repair defects in the blood-brain barrier. What's the blood-brain barrier? The blood-brain barrier is, so in your body, you have, in blood vessels, you'll have spaces where molecules can go between blood and tissue. But the brain needs to be protected from a lot of those fluctuations throughout the rest of the body. So those areas where other molecules can cross are restricted to certain parts of the brain, and that barrier is a lot tighter. So amyloid is important, again, for antimicrobial, anti-tumor effects, and then also for maintaining the blood-brain barrier. Even though amyloid is very important for brain function, overproduction and underexcretion of amyloid can be problematic and can lead to disease, as you will see in Alzheimer's. Just going to load everything onto this slide first, and then go through it. Perfect. So this has a lot of scientific jargon on it, but the first protein that you see, let me see if I can use I don't think this thing has a pointer, but maybe with a mouse, yeah. So you will see a protein that's called amyloid precursor protein, and this is processed by two other proteins, or by a general set of proteins, let's say, called secretases, and they process amyloid, and it can be processed into amyloid beta, which is shown by A beta here, 40 or 42. And this slide can be broken into two halves. And the side with amyloid beta 40 we can consider to be non-amyloidogenic, and the other side we can consider to be amyloidogenic for the purposes of discussing Alzheimer's disease. So in Alzheimer's, amyloid beta 42 can accumulate into structures called amyloid fibrils, and this can be associated with overproduction or underexcretion of amyloid. And these fibrils can join together and form things called amyloid plaques, which you can see outside the cell. And this is part of the underlying disease process in Alzheimer's. So, as I mentioned, amyloid is important in maintenance of the blood-brain barrier. And this is particularly the case in small blood vessels over the surface of the brain. So amyloid accumulation in small blood vessels over the surface of the brain can cause cerebral amyloid angiopathy, which I believe Dr. Tarsia is going to discuss later in the afternoon. But that can cause small bleeds over the surface of the brain. And then in Alzheimer's disease, amyloid beta 42 can deposit outside of the cell in structures called plaques, which are an accumulation of amyloid fibrils. And these plaques are toxic to the brain. So in Alzheimer's, plaque formation is the first thing that happens, amyloid plaque formation, and then tau accumulation, which we'll talk about shortly, follows. So again, just to show this picture again, we're talking about, this is amyloid plaques, which look like this. And now we'll move on to tau. So tau is important for the function of a certain thing in the cell called microtubules, more scientific jargon. So what's a microtubule? A microtubule is something that allows transport of nutrients or other things within the cell, and it's vital for cell function. Tau proteins help that transport happen. So they can affect the ability of each of the subunits or different parts of microtubules to join to each other. They can affect the transport itself directly, or under changing conditions, they can affect or promote structural flexibility of that whole apparatus such that the intercellular transport happens. So one of the things that's important for regulating how tau functions is called phosphorylation. That's a fancy term for attaching a small molecule called phosphate to something. So when tau is phosphorylated more, it can separate from microtubules, which can cause destabilization of microtubules. And then when tau detaches, it can form these structures called tangles, but this time inside the cell. And this phosphorylation, even though this is a little bit beyond the scope of this talk, can occur at different areas on the microtubule in different diseases. So as I already mentioned, these aggregates of hyperphosphorylated tau, so tau with a lot of phosphate on them, can form these tangles inside cells, which are toxic. And when it's toxic to brain cells, you can have failure of neural networks. And because of that, you can have cognitive decline. And then you'll see diseases, depending on where this accumulates, you can see the clinical phenotype or what the patient is actually experiencing with diseases such as Alzheimer's. So just as like with amyloid and then again with tau, it's not necessarily true that the protein in and of itself is problematic. What's problematic is the other things that are going on, the loss of regulation of its proper function in the cell, in this case, overphosphorylation. And when we're looking under the microscope at what this actually looks like, if I can get my cursor there, this is what it looks like. So, and like I mentioned previously, you can have different diseases occur based on where this protein, when it's overphosphorylated, where it accumulates. That will determine what type of disease you see. So if this builds up in areas that are important for memory, you can see Alzheimer's disease. You can also see something called LANS, or you might hear the term late, which it tends to be more slowly progressive. It can also be caused by a molecule that we'll discuss later called TDP-43. But if you see terms like limbic age-related TDP-43 encephalopathy, which is late, That's what it's referring to with all these acronyms. If you have buildup of this protein of tau, of phosphorylated tau, in areas that are important for motor function, then you can see other diseases that we'll see in movement or cognitive clinics, such as progressive supranuclear palsy or corticobasal syndrome, or if it is, and which can be caused by other proteins, but if it is caused by tau, as corticobasal syndrome is called corticobasal degeneration. And one thing that we've come to appreciate more and more over time, which I'll touch on towards the end of this talk, is that in the past, neurologists encountered these diseases, evaluated them, and saw patients when they're at the point of frank neurodegeneration. But this disease process is occurring way sooner than when we, at least in the past, and still now, encounter patients in clinic. So these changes, whether it's accumulation of beta amyloid plaques or later hyperphosphorylated tau, or then when we can see the disease clinically or with imaging, all of this is happening even before we encounter the patient in clinic over time. All right, so that's Alzheimer's disease, amyloid, and tau in a nutshell. And now we'll move on to alpha-synuclein. Alpha-synuclein is another protein that is very important for normal brain function. It organizes synaptic vesicles. What are those? Those are collections, basically, of neurotransmitters that are released between brain cells that allows them to communicate. Alpha-synuclein organizes those, and then it also regulates neurotransmitter release timing. And this is really important for neural circuits that are required for precise timing, let's say for motion, for example. And this is so much the case that even for dopamine, which is a neurotransmitter, a lot of these neural circuits will rely on precise pulses of dopamine. So alpha-synuclein and dopamine as well, though alpha-synuclein also affects other neurotransmitters such as norepinephrine, is important for a variety of neural circuits that we think about a lot of times in movement disorders, but also in Lewy body dementia, so Parkinson's disease, Lewy body dementia, and that sort of thing. So, and there are three pathways that I've included here, and those are the mesocortical pathway, mesolimbic pathway, and nigrostriatal pathway. Those are all fancy terms, but what those mean are for the nigrostriatal pathway, that involves release of dopamine going to centers that allow for movement, as you can see here, from the lower part of the brain in an area of this is called the brain stem, but called the midbrain. And then it releases dopamine up to an area called the striatum, which is important for movement. And then this is also involved in the mesolimbic pathway, which goes from a slightly different area, but that is adjacent to it, called the ventral tegmental area, to centers for motivation and for drive. And that's in this diagram is referred to as NAC, or that's called the nucleus accumbens. And then lastly, the mesocortical pathway goes for some of those similar areas up to the cortex, meaning the surface of the brain, and especially in the frontal lobe and other limbic areas. And that's important for paying attention to things. And all of these different pathways are all integrated and all work as one. But that should make sense, because first you need to be motivated towards something, then you need to be paying attention to it, and then you end up acting on it. So to go back to alpha-synuclein, what can happen is that you can have a misfolding of alpha-synuclein, and when this protein misfolds, just like when tau is hyperphosphorylated, or beta amyloid accumulates in fibrils and then into plaques, you can have this accumulation or aggregation. And in this case, for alpha-synuclein, we call these Lewy bodies. And spread of Lewy bodies disrupts neurotransmitter release and signaling between neurons. And this disrupts all the different pathways we talked about for motion, for cognition, and so on, and then can result clinically in different neurodegenerative disorders. So, and I think we already went through a lot of this actually in the other slide, but for the nigrostriatal or movement pathway, when the disease predominantly affects that pathway, you'll see motor slowing, you'll see rigidity, and you'll see tremor, typically resting, though it can be otherwise. And that's what we call Parkinson's disease. If it affects the areas more for cognition, then you'll see fluctuating confusion, other cognitive changes, and hallucinations in particular. And this is called Lewy body dementia. But whether you have hallucinations, psychosis, or the symptoms that classically we think more for Parkinson's, areas lower in the brain stem, so down here, are affected by this disease and can cause issues with attention, cognition, level of consciousness, even sometimes, which can fluctuate, especially in Lewy body disease, and also sleeping problems. And these are present throughout any of the synucleinopathies, such as Lewy body disease or Parkinson's disease, or another disease that I'm not going to go too much into, which is called MSA, or multiple system atrophy. And even though we separate Parkinson's and Lewy body dementia clinically, the truth is that there is a lot of overlap between these two, even with the symptoms that patients can have, even clinically. But that's just a reflection of the pathophysiology being similar. And this is an example of what a Lewy body looks like, which you'll see in Lewy body disease and you'll see in Parkinson's disease. And I would also like to mention that the proteins we discussed before, amyloid and tau, you can also see Alzheimer's pathology, not infrequently, along with these two diseases, those two being Lewy body dementia and Parkinson's. All right, and last but certainly not least, I feel like maybe we should put this one first because this is one where it's underappreciated, not just publicly, but I really think by clinicians too. And I would count myself among them, especially starting as a resident. And frankly, I didn't even learn about this until residency. So the last protein that we'll talk about is TDP-43. And TDP-43 is very important for regulating RNA processing. So if we go back and think about when I was mentioning that pathway for what is protein. So RNA is what is made from DNA, and then RNA is eventually made into protein. So TDP-43 is very important for regulating or helping control proper RNA processing. And TDP-43 is usually located in the cell nucleus or in the center of the cell. But it can occasionally accumulate elsewhere. It can be in the nucleus and in the cytoplasm, or mostly in the cytoplasm, but if it is in the cytoplasm, it can form abnormal inclusions, or those aggregates of protein, again, that are toxic to cells, brain cells in particular. And this is associated with different syndromes, which we've discussed already since we touched on frontotemporal dementia, but that includes frontotemporal dementia, also ALS, and amnesia in older adults. The acronyms for that, you'll see LANS, L-A-N-S, or LATE, L-A-T-E. These tend to have memory impairment, but they can be more slowly progressive than Alzheimer's disease. And like I mentioned before, this is something that's under-recognized, not just publicly, but also I think by physicians. So, and it's very important to keep in mind, not just from the standpoint of a primary cause, but also from occurring with other forms of pathology. And this can occur together with tau, with synuclein pathology, and all these things can coexist, especially as one gets older, in the same patient. And on the far right here, you can see an example of what a TDP-43 inclusion looks like on under a microscope. So we have gone from Alzheimer's disease with amyloid beta and tau to Lewy body dementia and Parkinson's disease, which are driven by alpha-synuclein pathology, and then frontotemporal dementia, as well as a few other syndromes that can be driven by tau pathology as well, or TDP-43. And so hopefully what I've given you with this overview is an understanding that you can have a clinical syndrome like Alzheimer's disease or Lewy body dementia or Parkinson's or frontotemporal dementia. But those diseases can be caused by or can have contributions from different types of pathology. So we look at a certain disease presentation or how the patient looks or what they're experiencing, and we don't just ask what is the disease syndrome, but what is actually causing it underneath that, because that's what we're looking to treat. So, as I mentioned a few slides back, in the past, and still to a reasonable extent currently, physicians, when we encounter a patient, we are seeing them when they are symptomatic. When someone says something is wrong, can you please take a look at my husband or wife, brother, sister, and so on. And we're dealing then with, when something is symptomatic, with all of these changes that have happened for years. So in this case, with Alzheimer's disease, you have decreased clearance of amyloid, and then you'll have formation of the amyloid plaque. Then you'll have accumulation of tau, and then it will become toxic to the brain. And all this will happen before you typically have recognizable symptoms. And then the patient, or someone who is related to the patient, will bring the patient to medical attention because they think that something is wrong. So our approach in the past has been dealing with symptoms once all that disease process has already firmly established itself. But the future lies in essentially going back in time, so to speak, and going further toward the beginning of the disease process and identifying it and seeing what we can treat earlier on. So that is the purpose of biomarkers, such as tau. We also have biomarkers for amyloid. And these can be helpful for earlier detection of the disease before it becomes frankly symptomatic. It can clarify the underlying cause, which can be confusing because certain underlying causes can cause different clinical syndromes, as we discussed. And also, clarifying the underlying pathology can make clear if a patient is a candidate for a certain clinical trial. So, understanding the underlying pathology, the underlying disease process, is important for diagnosis, understanding the trajectory of the disease, understanding treatment selection, and seeing if a patient might qualify in any clinical trials, or for any clinical trials, excuse me. So that is my overview of neurodegenerative diseases. Thank you very much. It's a pleasure to address all of you today.
Thank you, Dr. Nelson. Thank you very much.